We know that 72% of women have noticed skin changes after using hand sanitizer. Could this be a long-term problem?
I'd like to think we were all washing our hands regularly before coronavirus came along. However, there is absolutely no question that all of us are much more conscious of it now. And importantly, we're washing our hands not just more often, but for longer. Now, a lot of people don't realise that even water can dry your skin out. We don't recommend, on the whole, that people use soap substitutes, which are normally given to children with eczema, for instance, as an alternative to soap if you're washing your hands with soap and water. And of course, in addition, we're encouraging everybody to use hand sanitation if they can't wash their hands. Add that all together, I'm not remotely surprised that 72% of women said they were having more problems with dry hands. In fact, part of me is only surprised that that figure isn't higher. So we can do a lot. The one thing we must make sure, though, is that people continue to sanitise regularly. Until now, we've recommended 60% plus alcohol gels because we know that they always work if you use them properly. Of course, we recommend hand washing when you can. But the problem we've got is that if you're not going to use it because it's drying your skin out, that could be a risk too. So it's great to have alternatives such as hypochlorous sanitisers because that may encourage people to wash more or to sanitise more.
What hand hygiene advice would you give to patients?
If you've had skin issues linked to hand sanitizer use, you need to moisturise more, almost certainly. Moisturisers don't last very long. They're very effective, and what they do is replace water that's lost and to an extent provide a barrier so that you don't lose more water. But very often that isn't enough. I do not recommend that you stop washing your hands and you stop sanitising your hands because we know that while the spread of COVID may not be as much as we originally thought through so-called fomites, which is contaminated surfaces and touching them, we do still very much think that there is a role for picking up the virus on your hands and spreading it through your eyes, your nose or your mouth. Therefore, if you find that alcohol-based sanitizers are irritating your skin and it's putting you off from washing, I would suggest that you look for an effective alternative, and using hypochlorous acid is an effective alternative which is gentler on the skin. It's widely used in hospitals, has been for many years for disinfection, and indeed has been well proven to be very gentle for the skin.
Are some people discouraged from using hand sanitizer?
I don't think there's any question at the beginning of lockdown we were all scrupulous about washing our hands. And of course, we were having to learn to do it in the way that surgeons do it. People talked about wash your hands as if you've just chopped chilies and you're about to put your contact lenses in, but certainly for 20 seconds and making sure that every bit of your hands was covered. That meant longer contact with water and more frequent contact with soap, and that very quickly led to a great deal of irritation. So if your skin is becoming dry, chapped, sore, red, inflamed, it's not surprising that you're going to think twice about using a sanitizer, and that to me is a concern.
What about hard surfaces like mobile phones?
We don't exactly know how much virus survives on hard surfaces, but we do know that it does. Probably the best research we have suggests that it can survive for up to 24 hours on perhaps cardboard and up to 3 days on hard surfaces such as metal, apart from copper, but not many of us use copper, glass and hard plastic. Therefore, it is really important to think seriously about your mobile phone. You may be washing your hands, but if you promptly pick up your mobile phone, which you carried with you wherever you go, it's quite likely to contaminate you all over again. So it is very important to get into the habit of cleaning those products with something which is gentle and isn't going to do them harm.
What advice can you give to mums?
As a mother, I can tell you it is completely impossible to keep your child completely clean. Indeed, nor would we want to. We still want them to get out and about and get dirty and have mud pies in the garden. That's the way they pick up germs that aren't coronavirus, and that's how they build their immunity. However, for the rest of the time when they're coming into contact with other people, it is really important for their sake, but perhaps more importantly, for the sake of perhaps elderly, vulnerable people they come into contact with, that they stay infection-free. Now, the first thing, and perhaps the most important, is to set a good example. You need to get into the habit of washing your hands in front of them, to explain why you're doing it without worrying them too much, and indeed explain to them that they probably wouldn't get poorly at all, but they're doing it because it's an important job for other people. Then show them how to do it. And of course, the same thing applies when you're out and about with other people rather than out in the country, in which case they can get as muddy as they like. But they should be using hand sanitizer when they're in areas where they could become contaminated. It's not surprising that if a child is picking up irritation on their skin and soreness and redness, and they link it with the hand sanitizer, they might not be keen to use it. Therefore, for them, because children are even more prone than adults to having sensitive skin and much more likely to have eczema, which can lead to soreness and inflammation, it may well be worth using a hypochlorous acid product, which is gentler on the skin, but which is also proven to provide effective sanitation. One of the few great joys to come out of lockdown and the pandemic is the emergence of all those perhaps unlikely and certainly unsung heroes. So do you know a local hero who could do with a helping hand? If so, you can head to Steril-eeze.com and find out more about their Helping Hands initiative, where they can get a month's free supply of sanitizer.